Welcome to another episode of Dean Hospital Health Digest. In this episode we shall be discussing a very important topic. It is a condition that affects an estimated 10% of the world population. Yet it is shrouded in a lot of myths and misunderstandings. Follow keenly as we explore peptic ulcer disease, otherwise shortened as PUD. What is peptic ulcer? Peptic ulcer refers to a sore that develops on the lining of the esophagus, stomach or the first part of the intestine called duodenum. Therefore, if it occurs in the esophagus, it is called esophageal ulcer. This is the least common. If it occurs in the stomach, it is called gastric ulcer. And duodenal ulcer, if it occurs in the duodenum. This is the most common. When we eat, the stomach produces acid and enzymes to aid digestion of the food. Normally, the stomach wall is protected from the effects of the acid by a layer of mucus and bicarbonate that neutralizes the acid. Any defect in the mucus lining exposes the stomach wall to the acid, resulting in ulcer. Generally, peptic ulcer results from one or combination of these two factors. 1. Damage to the protective mucus layer of the stomach. 2. Increase in acid production in the stomach. Damage to the protective mucus layer of the stomach is usually due to a. Infection by a bacteria called Helicobacter pylori. This is the most common cause of peptic ulcer. B. Side effects of drugs such as a group of pain relievers called non-steroidal anti-inflammatory drugs, NSAID, like aspirin, diclofenac, ibuprofen, felden etc. Or steroids such as dexamethasone, prednisolone etc. Increased acid secretion in the stomach can result from chronic stress, excessive alcohol intake, excessive caffeine intake such as from coffee and tea, smoking, spicy foods. Note that, while smoking cigarettes and drinking alcohol can make you more likely to get ulcers, stress and eating a lot of spicy food don't cause ulcers, as popularly believed. But they can make ulcers worse and harder to treat. Symptoms may include 1. Stomach pain, usually between the breastbone and navel. Pain may get worse between meals and may wake you up at night. 2. Indigestion and frequent heartburn. 3. Bloating. 4. Excessive burping. 5. Nausea with or without vomiting. 6. Loss of appetite resulting in unintended weight loss. Without the right treatment, ulcers can continue to erode deeper into the stomach wall and may result in 1. Bleeding, which usually presents as hematemesis, that is vomiting of blood. Ground coffee brown vomiting when the blood has been altered. Melanina stool, that is black tarry stool when the blood has been digested. Bleeding may be small but prolonged and may result in iron deficiency anemia. Occasionally, it may be severe and life-threatening, often requiring transfusion. 2. Perforation. The ulcer creates a hole through the wall of the stomach, allowing food to leak out, causing peritonitis and acute abdomen. It is life-threatening and requires emergency surgery. 3. Obstruction of the outlet of the stomach, from swelling or scarring, that blocks the passage of food from the stomach to the small intestine. This results in upper abdominal pain, distension, nausea and vomiting. Diagnosis consists of 1. Your doctor will take a detailed history of your symptoms and perform physical examination. 2. Laboratory tests to detect the presence of Helicobacter pylori bacteria. 3. Endoscopy. A thin tube will be passed down your throat and into your stomach and small intestine. The tube has a camera at the end so they can check the lining for ulcers. They may also take a small piece of the lining, biopsy, to test. 4. Serial X-ray using contrast medium. Note that ultrasound scan is not included in the diagnosis of peptic ulcer. This is because, contrary to the popular opinion, the conventional ultrasound scan cannot diagnose ulcer. However, it can help to rule out other causes of abdominal pain. Treatment modalities includes 1. Antibiotic medications to kill H. pylori bacteria. 2. Medications that block acid production and promote healing. 3. Antacids that neutralize stomach acid. 4. Medications that protect the lining of your stomach and small intestine. Some questions to need to be clarified. 1. Are ulcers curable? The answer is yes. For most people, treatment that targets the underlying cause, usually H. pylori bacterial infection or NSAIDs, is effective at eliminating peptic ulcer disease. Although ulcers can reoccur, especially if H. pylori isn't fully cleared from your system or you continue to smoke or use the offending drugs. 2. What should ulcer patients not eat? No foods have been proven to negatively impact on all ulcer patients. My advice is that whichever food you notice to affect you should be avoided. Generally, it may benefit to avoid or limit the following foods: coffee, chocolate, spicy food, alcohol, caffeine, acidic foods, such as citrus and tomatoes. 3. Why does peptic ulcer appear to be incurable in some individuals? This can be due to several reasons, which includes a. Wrong diagnosis. B. Improper treatment by not using appropriate drug combinations. C. Not avoiding the risk factors such as smoking. D. Not treating it long enough. It takes between 6 to 8 weeks of proper treatment for most ulcers to heal. In summary, peptic ulcer is a very common health condition that is still poorly understood by the general population. Contrary to the previously held belief, peptic ulcer does not result from stress, fasting or consumption of spicy foods. The most important causes are infection by H. pylori and use of non-steroidal anti-inflammatory drugs. Testing for H. pylori and endoscopy are the investigations necessary for diagnosis of peptic ulcer. It takes appropriate diagnosis, use of correct drug combinations taken for long enough period of time to effectively treat or cure peptic ulcer. If you notice any of these symptoms, or have concerns about your health or wish to have a comprehensive health check, please visit us today at Dean Hospital Isanlu. We are your reliable partner in the healthcare industry.
Thank you for your attention. We love you.